Whether something is deemed a success or a failure generally depends on its ability to reach a goal, right? When discussing the American healthcare system, many people, myself included, often reference the various failures therein. The problem is, they're not failures at all. The system is functioning precisely as it is designed to function. It is not designed to provide equitable care to everyone in the country, or even an overwhelming majority. It is designed to make money. And by that metric, it is a roaring success. Insurers made $35.7 billion last year and are primed to absolutely crush that total this year. During a pandemic? Yes, during a pandemic. Healthcare stocks have surged during the era of COVID, and consequently, healthcare billionaires saw their wealth increase by $150 billion. Yes, there are healthcare billionaires, plenty of them. Here's 14 of them who made the Forbes list of America's richest people. We have a for-profit system. It exists, get ready for this, for profit, and business is booming. So it shouldn't be a surprise that an estimated 26,000 people die each year due to a lack of health insurance, or that 32% of Americans reported not seeking medical care due to the cost, or that 28.9 million people do not have health insurance at all, and millions more are underinsured, or that at least 12 million people lost their employer-sponsored insurance during the pandemic. Healthcare isn't a right in America, it's a privilege, a luxury granted to those who are fortunate enough to receive coverage through their employer or have enough money to pay for coverage on their own. This is a system better designed to exploit a crisis than adequately handle one. We pay more for healthcare than every other nation because our system, a system that directly reflects the inequality that surrounds it, demands it. The problem isn't the failures within the system, the problem is the system. It's like you made a meal, right? You cooked dinner. Good for you. You whipped up some mac and cheese. But then you looked at it and you were like, ah, shit. I really wish this was meatloaf. That's what's happening here. That's what's happening. If people really believe that healthcare is a right, we need to remove the profit motive entirely. We cannot continue to subsidize this current exploitative system. We will never get to universal coverage within this framework. You can't turn mac and cheese into meatloaf, Mark. Mark is my imaginary detractor. Don't be like Mark. If we want to ensure healthcare as a right, we need to lower the price of healthcare. Again, we pay more than everybody else. Check this out. You see that dark line above all the others? That's us. That's how much more we spend on healthcare than other OECD nations. And guess what? The other nations on this chart spend that much less than we do and provide universal health coverage for everyone. Well, okay, but our healthcare is the best. No, it absolutely isn't. Here's a chart showing life expectancy. See that yellow line at the bottom? Again, that's America. We're first in spending of OECD countries, last in sustaining life. Here's the infant mortality rate of the US and countries in Europe. That green line, one more time, is us. We have to lower the price of care to get everyone covered. And we're not going to be able to lower the price within a for-profit system with rampant abuse at every level and an insane, abusive, labyrinthian billing structure that requires thousands of paid personnel. Can we make small strides and improvements? Yeah, kind of. But if we're serious about ensuring healthcare as a right, we need to remove the profit motive by removing the system. We need a system that prioritizes care over capital. And you're not going to believe our luck. That system exists. In fact, nearly all of our peer countries already have it. It's functioning quite well and has been for decades, and we even use it. It's called a single-payer system. And while it's not perfect, no system is, it would be an enormous improvement over what we have now. In a single-payer system, the government pays for the healthcare of its people through taxes, like with Medicare and Medicaid. A system like this enables one body to control the pricing, so people aren't being charged $10,000 for a CAT scan. And there are no more healthcare billionaires. Thank God. The government does not control the hospitals in this system. It is not a nationalized system. They just take care of the payments. And it will be much, much cheaper for the public as well. According to a study by The Lancet, Medicare for All, the single-payer system championed by Bernie Sanders and supported by progressive lawmakers, and approved by the majority of the public, this system would save $450 billion a year and could save an estimated 68,000 lives. Taxes will increase some, but you won't be paying for health care. Overall, in nearly all scenarios, you will be paying far less. You would have great health coverage, and you would feel proud to live in a country that doesn't let people die because they can't afford health care. And don't do it. Don't you fucking do it. Don't you say,
people can always go to the ER.
According to an analysis by the Healthcare Cost Institute, the average ER visit costs $1,389. And people shouldn't have to go to the emergency room for a non-emergency situation. We shouldn't be filling our emergency rooms because people can't afford to go to the doctor. Preventative medicine and early detection are what helps keep people alive. And people are not going to the emergency room for preventative medicine. Friends, U.S. healthcare is a disaster. Don't fall for the socialism scare tactics that have been employed for forever. Actor and later President Ronald Reagan recorded this insane bullshit 10-minute LP in 1961, warning people how socialized medicine and Social Security would mean the end of the United States as we know it. It's the same old refrain. This was brought up over and over again with Medicare and Medicaid. We need a single-payer system, just like the ones that exist all over the world. We need Medicare for all, and we need it decades ago, like when Harry Truman first proposed it in the 1940s. So if you want to push for healthcare to be a right, and you should, don't push for some weak-ass middle ground that keeps a for-profit system intact. Forget that tepid nonsense. Be bold. How many fundraisers, how many GoFundMe campaigns have you seen over the past few years to help people pay medical bills? Someone gets in a car accident, and they need surgery, and it costs tens of thousands of dollars, often even if they have insurance. Someone needs a tumor removed, and to pay for it, they're in danger of losing their home. So they need to decide between surgery and a place to live. How in the hell is this the best we can do? Single payer now. I'm Jesse Mechanic. If you like this video, please subscribe, hit the bell icon, share with your family, friends, and anyone you've ever met. We're trying to really educate and speak about these topics in a more in-depth level, and we want to grow this platform, and that's how we're going to do it. So please subscribe. Thanks.